Hi, I'm Dr. Rachel Kalin. Thank you for watching our online LapBand information seminar. In the next few minutes, we're going to be talking about why diets don't work, why LapBand surgery is a wonderful option for long-term sustained weight loss, and how our practice can help you navigate the insurance and cost process and get the LapBand done. So now, join me and my partner, Dr. Ron Hecker, as we begin by talking about why traditional diets don't work in the long run. Dr. Hecker?
Hi, I'm Dr. Ron Hecker. Dr. Kalin and I have been performing LapBand surgery in Texarkana since 2004. By the end of 2011, we've performed over 1,600 LapBands and seen our patients lose over 87,000 pounds. We're both board-certified general surgeons, and our practice was twice recognized as a Bariatric Surgery Center of Excellence by the American Board of Bariatric and Metabolic Surgery. You might wonder why we, as surgeons, chose to enter the weight loss field. Well, we've seen too many people suffer from being overweight. Being seriously overweight is a problem that can affect almost every aspect of your health, such as diabetes, high blood pressure, arthritis, back and joint pain, infertility issues with female hormonal cycles, pregnancy complications, and it also increases the risk of several types of cancers, such as breast cancer, colon cancer, and prostate cancer. It can be a cause of sleep apnea and exacerbate asthma. And with all of these associated health problems, we wanted to offer a solution that could improve a person's health before they got sick. Just about every single patient of ours had one thing in common. They tried diets, and in some cases dozens of diets, spending a lot of time and a lot of money on these diets. They might have lost some weight, but the weight loss never lasted. Ask yourself, have you ever been on a diet and lost some weight, but months later gained it back and wonder why you wasted all that time and all that money? Well, the reality is that there are thousands and thousands of diets. Go to Google and search for the word diet. You'll find over 517 million pages on the internet that come up for the word diet. Go to Amazon.com, the world's largest bookseller, and type in the word diet. You'll find over 64,000 books. There's a reason there's so many. No one single diet has been proven to be successful. So let's take a look at some scientific medical studies of diets. You know, there have been numerous scientific studies of diets where people not only go on a diet, but also they enroll in the study and then they check in with a doctor or some other researcher on a regular basis to review their progress. Many medical studies find that the weight loss at the end of 1 year of being on a diet is usually quite modest, usually about 10 pounds. So if you weighed 270 pounds at the beginning of a diet, after 1 year of starting your diet, you might lose some weight, but gain it back, and you'll probably end up down only about 10 pounds to a final weight of 260 pounds. Well, in our practice, we've seen many different types of patients at many different weights. And the patient who undergoes LapBand surgery in our practice starts off weighing about 260 pounds. Unlike medical diets, at the end of 1 year, our patients who've had LapBand surgery weigh on average about 210 pounds, for an average weight loss of about 60 pounds within the first year after having LapBand surgery. This is certainly much more effective than a standard diet. And the problem is that no single diet works in the long run because they all have the same problem. They don't control your hunger. Our minds and our bodies have adapted and evolved to generally try to eat as much food as we can. And if only we could eat smaller portions, it would make a big difference in our calorie intake. Let's take a look at this slide. If you fill a standard sized plate the way most of us would, even with healthy food such as tuna and vegetables, then you end up eating about 660 calories. If you can get by with eating the same food but on a much smaller plate, you can cut out more than half the calories, about 400 calories less. Why is this so important? Well, to burn 400 extra calories, you'd have to walk about an hour and a half straight. And that's just to burn off those extra calories from that one meal. Add the rest of the meals from the day and you get to an impossible situation. So the solution is easy, right? Just eat a lot less food for the rest of your life. Well, why is that so hard to do and in many cases unsustainable? Because of our hunger. Generally, these small-sized portions won't satisfy the typical person. You get hungry, so you eat more. If only there were a way to control our hunger. If we could control our hunger, it would be easy to control our portions, keep them to a small size, and then we could lose weight. That's where the LapBand comes in. The LapBand surgery works by controlling your hunger, allowing you to eat small portions and to feel full and to feel satisfied with these small meals. A typical meal might be 2 chicken strips and a few tablespoons of vegetables. And with the LapBand, this small amount of food can keep you satisfied for hours and hours until your next meal. So let's hear some more about the LapBand surgery from Dr. Kalin.
Let me share with you what I call the best kept secret in medicine. As far back as 1991, the National Institute of Health reported that for most people who are seriously overweight, diets don't work, and that they should consider weight loss surgery. How overweight should you be to consider weight loss surgery? The LapBand is FDA approved for people with a body mass index of 30 or above with weight-related health problems. Your body mass index, or BMI, can be calculated by entering your height and weight in the BMI calculator on our website. Some people consider weight loss surgery drastic or extreme, but you should know that the LapBand is typically performed as an outpatient procedure. You're typically home about 2 hours after the operation. Depending on your job, you might be back at work within just a few days. The operation is performed laparoscopically, which means small incisions the width of a finger are made to introduce a camera and allow instruments to be placed inside the abdomen. These smaller incisions mean much less discomfort than with an open surgical procedure and a much quicker recovery. Let's take a look at a short video that shows the LapBand surgery.
The LapBand system surgery is usually performed laparoscopically. The device is inserted through one of 5 or 6 small incisions and is wrapped around the upper part of the stomach. This creates a small upper stomach pouch and a narrowed outlet between the new upper pouch and lower stomach. The LapBand system is connected by a tube to an access port fixed to the muscle wall just below the skin of your abdomen. Using a fine needle, saline solution can be added or removed from the band to find the right level of restriction. As saline inflates the inner surface of the LapBand system, the stomach outlet becomes smaller. This helps reduce the amount of food you eat and slows the emptying of food from the upper to the lower part of the stomach. This helps you feel full sooner and stay full longer.
One of the keys to the LapBand is that it's adjusted to each person's individual needs. We'll want to see you in the office about every 4 to 6 weeks, both to discuss diet and exercise, as well as to possibly adjust the LapBand. An adjustment can be done to tighten up the LapBand if you're getting too hungry or too soon after eating a small meal. In some cases, it can be done to loosen up the LapBand, such as in the case of pregnancy. We have had several dozen women becoming pregnant after having their LapBand surgery. In many cases, they had infertility issues until they had significant weight loss with the LapBand. Well, once they became pregnant, we would often loosen up the LapBand a little bit to allow them to eat more during pregnancy so that they could meet their nutritional needs for both themselves and for the baby. After delivery, we can restart their adjustments just like any typical LapBand patient so that you can lose the weight gained during pregnancy, again after you've delivered the baby. The LapBand, with its ability to be adjusted for individual needs, has proven to be effective in many different kinds of patients. We have had patients as young as 18 years of age, as well as old as 76. In fact, our patient who was 76 when he had the LapBand surgery is now down over 100 pounds at the spry age of 79. So considering how safe and minimally invasive the LapBand is, then considering if you qualify, you may be asking yourself, how can you proceed with having surgery? We're very pleased to say that most insurance companies do offer coverage for the LapBand surgery. However, each insurance company has their own particular requirements before giving the okay to proceed. Some want letters from your primary care doctor summarizing your medical history. Some require evaluations by a mental health specialist, and some require documentation of medically supervised diets. We have a special team dedicated to helping you navigate the maze of insurance requirements, and we can help steer you through this process, from making appointments to requesting medical records and getting them forwarded to your insurance carrier. Based on our extensive experience, we know the requirements of many individual plans and can start bringing you through the process to get you through surgery as quickly as possible. Call our office directly, and we can tell you exactly what your specific policy requirements are. Remember, even policies by the same carrier, such as Blue Cross, may be different from one employer to the next or even within the same company. If you wish to avoid going through insurance or feel that you may not meet the specific requirements of your insurance plan, then we offer access to several different financing options in our office. Our finance assistant can help you apply for medical-specific loans, which are usually offered at a very competitive interest rate through national companies. Because we understand that financing surgery outside of insurance can be a great expense, we offer free aftercare in our office for up to a year after surgery to help you offset that cost.
We know we've gone over a lot of information, so let's take a moment to review everything we've talked about. Dr. Kalin?
For most people, diets will fail in the long run, something you probably knew already. And the reason diets fail is that they do nothing to control your hunger. The LapBand works by helping curb your appetite and control your hunger. You only have to fill up the top part of your stomach, and this allows you to limit your portion size so that you can eat less without struggling and lose all your weight. The LapBand is comparably safe, and it's an outpatient procedure with a short recovery time. It's meant to be adjustable for your entire life. It's not a temporary fix. Many medical problems resolve or improve after weight is lost with the LapBand, such as diabetes, high blood pressure, infertility, and back and joint pain. Surgery is often covered by insurance, but even if it's not, there are many different financing options available to you.
Will the LapBand work for you? Well, the LapBand's been placed in over 700,000 people worldwide, and we're happy to have over 1,600 patients in our practice. So what are you waiting for? Give us a call and take that first step to losing weight with the LapBand.